So just as a heads up, we are recording this session. By participating in the session, you are consenting to be recorded. If you do not want to be recorded, please just reach out to me or this email at the end, hit team@deahha.org. Excuse me. All right, so today we're going to be talking about some Region 8 preparedness efforts that are going on. Um, we'll cover some outbreak updates and just talk a little bit more about the future of funky bug in our program. So to get started, just to introduce myself, my name is Ariana Boschera. I am a project manager with the Denver Health High Risk Infection Team. Um, I will be covering this presentation today. And I also wanted to take a moment to introduce my coworker who will be joining us on this Project Echo, Katie Bristol. Katie, if you're able to come off chat, that would be great.
Hi, thanks, Ariana. I'm a project manager as well on the disaster health team at Denver Health. Looking forward to supporting Project Echo for the next year.
Great. Thanks so much, Katie, for being here. If you have questions throughout this presentation, just feel free to put them in the chat and we'd be happy to help you. All right, participants, if you wouldn't mind just putting your name and role in the chat so we can all just hear a little bit more about where you're coming from. Okay, so we'll start with some regional preparedness landscapes, talk about some current and emerging outbreaks, and then we'll just chat through what funky bug's going to look like in 2026. So a lot of you might already be involved with this process. So I'm just going to give a high-level overview of what's happening here in Region 8. So just as a reminder, Region 8 is Colorado, Utah, Montana, Wyoming, South Dakota, and North Dakota. We are working on something called the Region 8 ConOps, or the concept of operations, that'll align us on a special pathogens response plan and give us a little bit more structure, terminology, and some activation processes should we encounter that. So again, the goal is, as always, is to just be better prepared for any sort of high consequence infectious disease that may or may not come our way. So a few things that we're focusing on is just clarifying the scope and definitions of different things throughout the plan, and defining the authority, who we would reach out to should we have a special pathogens patient suspected or confirmed. Sorry. And then we'll be aligning assumptions, communications, and transport expectations, integrating training exercises and lab coordination, and just, again, working to promote consistency throughout the plan. So again, this might be something that you're already involved with, and just grateful to have you on board, and we're excited to get this out. So one thing that we've been working towards is just defining what a special pathogen incident is, what a high consequence infectious disease is, and then looking at all the different viral hemorrhagic fevers that we may or may not see come through Region 8. And we also like to talk about novel respiratory pathogens as well. So just part of our job scope is just keeping an eye on these outbreaks as they emerge throughout the globe. We want to establish consistent terminology that's up to date with our Joint Commission standards, identify signatories, and align activation criteria for both state and regional plans, and define roles of sending versus receiving states. So for example, if somebody is sick up in Montana, they might be closer to Region 10, which is in Washington, but is within our Colorado jurisdiction, or excuse me, Region 8 jurisdiction. So just something that we like to talk about and always keep on the back burner. Another thing that we're focusing on is legal considerations, just given scope of practice. This can look a little bit different for each state. And then we're also working with lab. As everyone on this call probably knows, the procedures for testing for different special pathogens are very strict and very definitive based on what the pathogen is. So just ensuring that we have consistency throughout that testing process. Another large domain is transport and operational readiness. So we're looking at what does transport look like for designated level 2, level 3 facilities, or level 1 like ourselves, or frontline agencies that might not deal with this every day. So what basics are we teaching them um, excuse me, ooh, what are we teaching them throughout the region, and what is the baseline preparedness that's needed for those people who don't encounter this kind of work? I apologize. Looks like the formatting got a little bit messed up here. But as I mentioned, just again, looking at those legal considerations for consistency across the region. Another big part of the Joint Commission standards is going to be training and what training looks like at each of the facilities. So one of the goals as the Regional Treatment Center is to help us standardize what training means and help each organization fill in the role and come up with what works for their processes and define what the training looks like on an annual basis. So next steps with the CONOPS, we're going to finalize the document itself and validate the assumptions and activation procedures. 2026 is going to be a big year for training and exercise priorities, and really, again, trying to involve those level 2, 3, 4 facilities throughout the region, and then just continue to build our cross-state collaborations. So if you have not heard about this project, just keep an eye on your inbox. This is something that will be coming through to you once it's finalized, and we're just really excited to get this project moving. All right, so second part of this presentation is just a quick overview of some current and emerging outbreaks. We want to keep this fun, special pathogens related. So just going to give a brief update of what's going on throughout the world. So these slides, which I had made yesterday, at the time there was a suspected viral hemorrhagic fever outbreak in Ethiopia. Since then, as of about 20 minutes ago, Ethiopia has confirmed that this is Marburg. So the WHO is investigating 8 suspected Marburg cases in southern Ethiopia, and lab testing is underway for additional confirmation. But they have confirmed that it is laboratory confirmed Marburg. So the WHO is responding as necessary with staff PPE and some financial support as well to support the response. I'm sure you'll be hearing more about this from us in the future, but just for now, something to keep an eye on. Lassa fever in Nigeria, which is endemic to Nigeria, but as always, just great to be aware of this. We're almost at 1,000 confirmed cases. So 8,367 suspected and 176 confirmed deaths, with a case fatality rate of around 19%. So a little bit up from 2024, but still around that usual endemic CFR. Rift Valley fever, there is an outbreak that has reached over 400 human cases with 42 deaths. And they're also just letting everybody know that animal outbreaks are very prevalent, which is how this is brought to humans in the first place. But the risk remains high just due to mosquito activity, things like climate change, livestock movement, things like that. There's also some news about a new Rift Valley vaccine that was just published, and just additional information that's showing it's safe for use, and ongoing trials are underway. As always, want to talk about measles, not a special pathogen, but something that's very relevant to all of our work. So just an update from the United States. There is an outbreak going on in Utah and Arizona at the moment, and we're reaching 182 cases alone in those 2 states. South Carolina also added 8 more, reaching 48 or 46 cases. All of the new cases are either unvaccinated or have an unknown vaccine status. And officials are just ramping up response and monitoring as holiday travel starts to begin. And then Canada also lost its measles elimination status, unfortunately. So they lost their measles-free status after more than 12 months of sustained transmission. They have 5,100 cases and over Oh, and two deaths. Oops. And two deaths across 9 provinces and 1 territory in 2025. Um, so again, this is just due to the declining vaccine coverage, hesitancy, and data gaps that we're all seeing across healthcare at the moment. All right, so that kind of covers some outbreaks that are going on at the moment. Last part that I wanted to just touch on is a little bit more about what's happening to this webinar itself. Just again, a huge thank you to everyone who's participated so far with our Funky Bug webinar. We're going to be changing a little bit in 2026, so I just wanted to kind of cover that ground and just talk a little bit more about what that's going to look like. Um, so we'll still be the lead organization here at Denver Health. But we are getting funding through the Robert Wood Johnson Foundation as a sub-award for mostly personnel support, but we're going to be expanding Funky Bug into a lot more of general disaster health. So not just looking at special pathogens, although that will be addressed quite a bit, I'm sure, but also other kinds of disaster health emergencies, so weather emergencies, traumas, environmental health emergencies, things like that. That's going to span a little bit beyond infection prevention. So we're going to start doing these bi-weekly instead of weekly, or monthly, excuse me. And there'll be 18 total sessions running from January 2026 to the end of September. And again, we're going to be talking about emergency management cases, clinical response to said cases, healthcare administration considerations, and of course, as always, public health. This will follow the same format as the NETEC and special pathogens world. So we'll be focusing on the Region 8 states, same as before, Colorado, Utah, Montana, North Dakota, South Dakota, and Wyoming. And we just have an overall goal, same as Funky Bug and special pathogens, but to strengthen collaboration and readiness across diverse systems. So we're going to be doing a lot of case-based discussions, which I'm personally very excited for, a lot of resource sharing, and just highlighting those regional challenges and solutions, working through the different scenarios. We're going to be sharing best practices and lessons learned, promoting equitable access to preparedness knowledge. That's one of the key tenets of Project ECHO is accessibility to knowledge. And that's something that we're going to work to promote, and just continuous learning and regional readiness. So Project ECHO, if you haven't already heard about what that is, it's a model which we're all on right now, that uses educational and telemonitoring and video conferencing to leverage case-based learning and the sharing of best practices to get the knowledge to the right place at the right time. So I'll teach, I'll learn. Again, it promotes that inclusivity and access to education. So why are we switching over? Well, as we kind of mentioned, this is a new grant that we're getting, but ECHO is just really about accessibility and equitable education throughout the community, which is something that's very important here at Denver Health and throughout our region. So we want to work with everybody under the sun, all different professions. We want to bring us together and just keep promoting that collaboration that keeps us prepared for these kind of disasters or things that we might see in the field. So just a few quick call to actions. If you or anyone you know wants to be part of this series as a lecturer, we are always looking for people. So feel free to just reach out to me or the HIT team email or Katie Bristol. Even if you don't know if you would be a good fit or the person you know might not be a good fit, that's totally fine. We can just talk through what you have to offer and what you think you would be great at presenting. We are open and excited to hear from a variety of different disciplines. So please don't hesitate to reach out and we can connect a little bit more. We're launching in January of 2026. And one other thing I just wanted to call out was that you're going to be receiving emails from the Mountain Plains newsletter. So it's going to look a little bit different than just emails from myself. But again, at any point, if you'd like to opt out of those emails, just let me know. As usual, I included some neat tech resources. These are just a reminder that these are free, wonderful, very informative resources that are available to you and to your organization to chat a little bit more about special pathogens. They have the basics, identify, isolate, and form. They have pathogen-specific care considerations. They have EMS, they have lab, they have everything that you could look for. So if you're ever looking for additional education materials, NETech is the place to find it. And again, I apologize for my formatting getting a little messed up here. All right, that is all I have. Nice and short, quick webinar today, but I will pause here to see if there are any questions. Okay, I'm not hearing any. If you do happen to think of some, please feel free to just reach out to me. We're always here as a resource, and I hope everybody has a great rest of your Friday. Thanks so much for joining.